Welcome back, everyone. We've taken a little bit of a hiatus from Einstein's Eyes. I've been away working on a healthcare project. It's good to see Jon, my buddy in New Jersey. Jon and I are ophthalmologists. I'm oculoplastics. Jon's cornea fellowship trained. And we trained at Albert Einstein College of Medicine in New York. I'm in Alaska. As I mentioned, Jon's in New Jersey. And today's topic is corneal ulcers, a real important topic, particularly if you wear contact lenses. And generally, you break it up into two areas, and then I'll let Jon talk about it. Infectious, like bacteria, viruses, fungi, molds, yeast, and non-infectious, like inflammation, toxic, medication, something called inflammatory ulcers, which can be related to inflammatory diseases that affect the body. But Jon, what's your approach to this?
Yeah, so I mean, one thing that's important is just experience. I think over the years, you start to get a feeling on when someone comes in with an ulcer, what's the typical presentation? And if it doesn't fit into that category, then you start thinking about these rare things. So, for example, the most common corneal ulcer that all eye doctors see is related to contact lens wear. Contact lens wear, although it's safe, it does cause little abrasions, little scratches in the cornea from wear. And if you wear the contact lens overnight, especially, you increase the risk of an infection in the cornea. And that's what an ulcer is. An ulcer is a white spot on the corneal surface.
Jon,
and it's basically.
Let me just show the folks what a corneal ulcer looks like, okay?
Yeah. So the patients that come in with where they wear contacts, there's definitely risk factors. So one can get a contact lens related infection, corneal ulcer, even if everything's done correctly. However, wearing the contact lens overnight, abusing your eyes essentially increases the risk significantly. Here you have a picture. So what are the symptoms? Typically, it's going to be a red, painful eye. So you can see it's red. And you might see a very small white spot, or in this case, a very large white area, which is what we call an infiltrate or ulcer. And that will actually have in it the organisms that are infecting the eye if you culture it. And there'll also be inflammatory cells in that culture. Now, in the old days, when we were training at Albert Einstein, right in the clinic, we used to culture all of these. We used to start the patients on specialized antibiotics that were called fortified antibiotics. I won't go into it too much because the good news is over the years, the pharmaceutical companies have come up with wonderful antibiotics that we can prescribe. So for the most patients, I'll prescribe 1 or 2 antibiotics that are prescription to be used very frequently, like every hour for an infectious ulcer. I might even add an antibiotic ointment at night, just so I know the person is getting antibiotics over 24 hours. And the way we monitor a corneal ulcer is very simple. It's an infection. So if the antibiotic's working, 48 to 72 hours later, the person should feel somewhat better. So this person that came in had blurred vision. They had very painful eye, barely could open their eye. 48 to 72 hours, their vision might still be blurry, but the eye should be a little less red. They should feel a little more comfortable. That's going to be the key. That's going to be the key to figuring out that they're doing well.
Right. Jon, let me jump in for a second.
Sure.
So,
sure.
There's different varieties, and we really don't like when people clean their contacts with tap water, or if you're camping with river water or streams, because there are organisms called amoeba that can cause really painful eyes and making people very, very light sensitive. But that's really for another topic. We wanted to focus here on the typical bacterial corneal ulcer related to contacts. And Jon, I'll let you wrap it up here.
Yeah. So as Carl's saying right at the beginning, there's infectious ulcers, there's non-infectious ulcers. It's a really broad topic. And just as he was relating to, there's really some that are so unique and so rare, we could do a tape just on that. I think for this topic, it's really mainly about bacterial ulcers that are going to respond to antibiotics. And if someone doesn't respond, that's when we start thinking about viral ulcers like herpes or acanthamoeba like he alluded to. So there's a lot of other possibilities.
Good. Jon, thank you so much. So we are going to wrap this video up. Again, bacterial ulcers primarily talked about in this YouTube video. We're going to do some others where we get into the other areas, the other types of etiologies of corneal ulcers. But great to see everyone. Like and subscribe. Jon, thank you again. Fantastic topic. We'll talk later.
Great.